Dear friends, welcome to Health Story Speak. Today we have Mr. Kulwant Singh, a colleague and a friend, who would like to share his health story.
On the World Cancer Day this year, I also joined Mrs. Manju Senapati for recording my journey with cancer. Last year, in 2023, I was diagnosed with non-Hodgkin lymphoma, which is a kind of blood cancer that usually develops in one's lymphatic system caused by genetic disorder. We are normally not born with these disorders. Instead, these disorders happen when genes inside certain cells mutate or change. In this case, that is in the case of NH lymphoma, the affected cells are B lymphocytes or T lymphocytes that are part of one's immune system. There are more than 70 types of non-Hodgkin lymphoma. People are living longer with these conditions thanks to the new treatments now globally available, including targeted therapies. In some cases, treatments eliminate all non-Hodgkin lymphoma signs and symptoms and cure the condition. In other cases, the goal of the treatment is to put the disease into remission for as long as possible. Last year, I experienced low backache for a fairly long period, and I visited an orthopedic at Narayana Super Speciality Hospital near my home in Gurugram. And my orthopedic initially, after examining clinically, said that, you see, I am having some kind of muscle pain. There was not much to worry about it. But 2 weeks later, when I went to him and I told him that I have to travel and my pain is still very acute, he has to help me out what to do about it. So he advised me further investigation through an MRI. And when MRI was done, you see, he suspected malignancy as a result of the findings of MRI. I traveled to the Netherlands, and there actually my pain really increased substantially. And I have to return back to India in more like an emergency situation because a proper diagnosis, that means further investigations, would not really be possible in the Netherlands where my actually children live. When I arrived back to India in the month of first week of June 2023, I visited Narayana Hospital. I met the medical oncology team, Dr. Randeep Singh and Dr. Pramita Singha, and they advised me to be hospitalized for diagnosis purposes. And soon thereafter, they did all kinds of blood investigations that included CBC, KFT, LFT, LDH, and other relevant blood tests. And they also got my PET CT, which is full body scan done for the entire body. After the report of my PET CT, where they were quite clear that I am having serious situation of cancer in my body, they wanted to find out where exactly, the cancer is located. So a biopsy was done by one of the surgical oncologists, Dr. Yadav. And as a result of all these tests which were done by the hospital medical team, I was diagnosed with what is called high grade non Hodgkin lymphoma, also called diffuse large B cell lymphoma. It was stage 3, and very naturally, it caused me a lot of mental strain when I was diagnosed with this kind of cancer. My physical condition was not so good. I was 77 years in terms of age, capable of only very limited self care, generally got confined to bed or chair more than 50% of my waking hours. And then I also had comorbidities, diabetes, which, as a matter of fact, I had for more than 12 years. Then there was a kind of complication of the coronary angioplasty because I was actually given two, uh, what you call them, stents, because in 2016, two stents were put in my body to install, and I did have a risk of coronary angioplasty with stent placement, you know. Then I do have some kind of hypertension that commonly coexists with type 2 diabetes. Obesity was also there, but not so much. And then also, uh, as per the age, I do have some kind of enlarged uh, prostate gland, uh, which of course is benign, not so cancerous. My treatment started at Narayana Super Specialty Hospital with what they call mini chop chemotherapy. And I was advised this chemotherapy treatment because that was the only one which was standard treatment available not only in India but also elsewhere in the world, whether it was UK or it was Germany or it was USA. So it was a kind of standard treatment for non-Hodgkin lymphoma, and I was advised that, and we started with that treatment by mid-June 2023, last year. As a starting point, doctors advise that you see they will have the chemotherapy, a kind of zero cycle, by giving me chemo, that means the medicines put in my body just to test how my body responds and reacts. And after this zero cycle was given, uh, I would say that chemotherapy was well tolerated by my body. It responded very well, which really helped, or you may say that it paved the way for regular chemo cycles. So 6 chemocycles, as a matter of fact, were given with a gap of 21 days in a daycare arrangement. I was not admitted for a longer period. After my diagnosis was over, I was sent home. Then there was a zero cycle which was there on 16th of June. And after that, which was also in a daycare arrangement. And then after that, 6 cycles, chemocycles with a gap of 21 days, they were really administered. And the medications injected in each cycle, they are standard medicines, 5 or 6 of them, which are really listed below: Reditax, doxorubicin, vinclizine, cyclophosphamide, Dexa, and then a capsule, what they called AKYNZEO. Impact of chemotherapy on my body was very much there. During the cycles, or you may say that after every cycle, I was experiencing variety of situations. Uh, in the first cycle or even the second cycle, I experienced a lot of constipation. And then in one case after that, I also had diarrhea, serious diarrhea, and I had to have some kind of emergency help from the doctors, from my, I would say that medical team which was attending to me. And of course, continued back pain was there, But I would say that I was advised in such situations substantial liquid or water intake. My understanding is that all those cancer cells were to be taken out of my body after the chemo cycles through my urine, and therefore substantial water intake was advised, which I had to almost like 3 to 4 liters minimum in a day after for almost for about 1 week after the every cycle chemo cycle. My other impact on my body was basically a big hair loss, basically, then body weight loss also. I lost almost like 15 kg during this period. And of course, a very interesting thing that I also experienced was, which I understood, was height shortening due to compression of my spine vertebrae. This was something, of course, it doesn't affect you directly whether you are now 2 centimeters or 3 centimeters smaller, but as a matter of fact, it did have impact on my back pain particularly. I, because of all that actually, and also because I had enlarged prostate gland, and then I also earlier I, because of my stents, the medical team attending to me was, as a matter of fact, having a regular consultation with the urology department and also with the cardiology department in the same hospital. There were periodic echo tests that were conducted after every 2 chemo cycles. After the three chemo cycles were over, basically second PET-CT scan was done in the month of September 2023, and the interesting findings were that there was a partial collapse of several vertebrae. That means several veins in my spine. When I say partial collapse, not only it was a partial collapse, but it was also that there was a kind of complete compression, and as a result, I, of course, had a problem with my back pain, which of course continued. And then, happy part was that the second PET-CT scan also gave a very encouraging response that my body was quite getting clearer from the cancer cells. That was the main positive finding as well. Besides, of course, the compressed vertebrae. So far as my spine was concerned. Then the three cycles were repeated at again same time gap of 21 days. And after the 6 cycles were completed, the third PET-CT was advised in the month of middle of November, which actually gave a very positive finding that my cancer cells were fully cleared. Obviously, My doctor, Dr. Randeep Singh, felt very happy for a very successful treatment. But then, as I said, that you see, my back pain continued, and I was advised to see my orthopedic again, who actually further advised that I should go for another MRI. And when I got my MRI done, MRI report really indicated a big compression of spine vertebrae so far as spine is concerned, and that pain was continuing. My orthopedic, Dr. Monu Singh, however, advised a very conservative management of the problem. That means a kind of medical management. He did not advise any surgery at this stage for this purpose. My main caregivers, after I was diagnosed with lymphoma, I would only say that the team of doctors in the medical oncology and hemato-oncology department, led by Dr. Deep Singh, who's the director and senior consultant, and in association with Dr. Premita Singha, senior medical officer, Dr. Mohit Saxena, Dr. Shubham Sharma, and their very dedicated and competent nursing team not only gave full care during the chemo cycles, but also provided practical support during the intervening periods between the two chemo cycles to address any kind of emergency that I had. For example, some kind of sudden dizziness, weakness, or unexpected pains or bowel problems. They really helped me out. At the same time, my main caregiver was my wife, as well as my son and daughter, Sukhbir and Mansi, my daughter-in-law, and my son-in-law, who all live in Netherlands. My son and daughter visited several times from the Netherlands and gave me both emotional and practical support. Coming to the subsequent treatment post chemo cycles, as I said, my problem with respect to my back pain did continue. And besides, of course, consulting my orthopedic, I also had consultation with Dr. Utkarsh Bhagat, a neurosurgeon in Narayana Hospital, who suggested both surgical and non surgical interventions uh, to address the issue of my compressed vertebrae. To begin with, actually, a Prolia injection was given in a daycare to treat osteoporosis that is caused by corticosteroid medications. He recommended spine surgery, minimally invasive neurosurgery, what is called kyphoplasty. But I, as a matter of fact, was quite scared of it, and therefore I postponed it, to a later date. In between, I had consultation with a professor of orthopedics, Dr. Ravi Mittal, in the All India Institute of Medical Sciences, New Delhi, who advised me not to go for any surgical intervention because results may or may not be positive for that matter. Broadly, my caregivers within the family, where we have so many doctors within the family, during my lymphoma treatment and post treatment recovery, were many of them I have been continuously consulting them. They gave me their advice, they gave me guidance, they gave me not only guidance, but also, as a matter of fact, uh, gave me a lot of encouragement to bring in positivity in me to address my problem, in a very significant manner. When I completed my treatment, my doctor, Dr. Singh, I asked him, what are the next steps? He said, go back and enjoy your normal life. But yes, that was very, very encouraging. He, of course, said that you visit me again now after 3 months or 4 months, and then we will review the situation. And I have to visit him sometimes in the month of and by end March, and then we will see next. But for all intents and purposes, uh, coming back, it's a new normal for rest of my life, because there can always be chances of relapse of NH lymphoma after remission. I have to be very careful about my weak spine. I am advised, obviously, no weightlifting, no forward bending, etc., etc. And then regular use of brace, particularly Taylor's brace. I was advised to see Dr. J.P. Singh, head physiotherapy, Narayana Hospital, who helped me getting me a very nice Taylor's brace, which I keep on wearing during my waking hours, or particularly when I go outside. I have, of course, been also advised yoga, meditation, and exercises, including walks, as wonderful healing tools. A friend of mine, who, as a matter of fact, with whom I have been also talking very regularly, he suggested the Johns Hopkins Cancer Centre uh, treatment, and where the this cancer center recommends Yoga Nidra, for which actually a link was given to me, and I have been using that for quite some time now. Also, a kind of spiritual healing is another possible answer through meditation. At the same time, some kind of homeopathic treatments are also possible to address the challenge of compressed vertebrae that I am experiencing, and I am still in consultation with some of the homeopaths. So I am very hopeful that since I have been successful in coming out of my cancer situation in a period less than 1 year, with the help of a very competent team of medical oncologists at Narayana Hospital in Gurgaon. Also, basically, I would say that in this entire process, I had, I would say that the support, inspiration, encouragement from my family, as well as my family friends and extended family, who actually have been really guiding, and perhaps I think uh, uh, giving a new ray of hope of coming back to a very, very normal situation. That thanks to you for taking this entire initiative of recording these stories, because they also, this sharing becomes very, very important.
Absolutely. So thank you. Thank you very much for your time and for sharing this story.
So kind of you. All the best.
Thank you.